Breast reduction surgery is one of my most common procedures. I have patients of all ages. I have patients from 16 to 60 and beyond, and they're coming in with basically the same complaints, mostly back pain, shoulder pain, difficulty buying bras, mismatch or being out of proportion, so their breasts are larger than their frame, or just feeling overwhelmed. I tell patients it's about becoming friends again with your breasts so that you're not fighting with them. So for breast reduction surgery, it's an outpatient surgery. Patients come to the OR, have surgery, go home the same day. It's important to know that during breast reduction surgery, I'm going to do everything in my power to maintain healthy blood supply to the nipple, as well as to keep as much breast tissue connected to the nipple as possible. And that's important for patients that do want to go on and breastfeed in the future. This is not a very painful operation. Patients have stinging of the incisions for about 24 to 48 hours, and then that fades away. A lot of times we'll wrap patients with an ACE wrap so that makes them feel secure, and they can use ice compresses to help with any discomfort. And we do give patients pain medicine that they may take for a couple of days. Bleeding is controlled at the time of surgery, and infection rates are very low. Specific risks for breast reduction surgery: scar formation. And so there are incisions that are placed on the breast. They are typically an incision around the areola and a vertical incision down the length of the breast, a horizontal incision that's underneath the crease of the breast. I tell patients it takes a full year for us to see how the scar matures. And we have a variety of treatment options for scar healing. If there's a scar that's raised, I can use a little steroid injection to kind of flatten that area. I can also use laser therapy to help decrease the pigmentation. And then I'm a big believer in silicone taping and silicone ointment. Another risk of breast reduction surgery is loss of erotic nipple sensation or sensation to the nipple. It's about 10% risk. This is because the nerve to the nipple comes through the rib cage on the side of the breast, and it goes through the breast tissue and then into the nipple. It's a very small nerve. It's not something that is readily visible or something that I can go out and find. So we typically try to avoid over dissection in the outside portion of the breast during the procedure. But I do tell patients it's about a 10% risk of losing or decreasing sensation in that nipple. If patients wake up from surgery and they have good sensation, then they should always have good sensation. If I have a patient that wakes up from surgery and maybe they have numbness or decreased sensation in one or both nipples, I tell patients we really have to give it a full year to find out if that nerve was bruised or stretched and it will repair itself over the next 12 months, or if it was truly damaged or cut and it's not necessarily going to repair itself. We like to say in plastic surgery that breasts are sisters, they're not twins. So there's always some degree of difference between the two. My goal is to decrease this asymmetry to make it as perfect as possible. But there's always going to be some subtle nuances between the two breasts. The degree of asymmetry should be subtle. It should be something that patients only notice when they're naked and they're staring at their breast or we're staring at their post-operative photographs. It should not be something that they notice in their clothing or anybody else should recognize after surgery. But that is a small risk for asymmetry. And those are the main risks of the breast reduction surgery. Other small things like can be seromas, a fluid collection that can occur after surgery, but those are very low risks. Breast reduction surgery is a surgery that I do quite frequently, and patients are very satisfied with their outcome. It really can help restore confidence, restore sexuality, and really help patients feel more confident in their clothing and beyond.